Welcome, my name is Jason Dixon. I'm with BevCat Management. This is for the Double K Energy Services. This is your 2018 open enrollment, and everything that we're going to talk about will go into effect on October 1st, 2018. What we're going to talk about through this is important dates, things to remember. We're going to talk about your provider overview, review your medical plans, talk about all other benefits, and then what are your next steps. First thing, this is open enrollment. What does this mean? This means that this is the time of year you get to enroll you and any dependents that you may have. You can change, add, drop, delete, whatever it is, but open enrollment will be from September 10th through September 15th. Benefit elections will go into effect on October 1st. The medical plan, let's hit the highlights. First off, your calendar year deductible will be $3,000. We have two different plans, and this is the first one. So you have a $3,000 deductible. Your out-of-pocket is $6,000. The plan will pay 80%, meaning you'll pay 20%, and they'll pay 80%. For preventative care, there's no charge, 100% free. For your primary care physician or just a normal office visit, there's a $30 copay. If you need to go see a specialist, there's a $50 copay. Your urgent care has a $75 copay. In emergency room, there is a $250 copay, then co-insurance. Our other video, we're going to show you a lot of the difference between emergency room and urgent care, but make sure you utilize the most cost-effective way when you're looking for those benefits. Inpatient, outpatient, from a surgery standpoint, we do have free surgical benefits, but if you choose to go to one of the Aetna network providers, you're going to have your deductible and then co-insurance. And then lastly, your prescription drug benefits is a 10, 30, 50 copay, meaning your generic, brand, or non-formulary costs are either a 10, 30, and a $50 copay. The second plan, much less, it's only a $1,000 deductible. Still have the $6,000 out of pocket. The plan will pay 80%. You'll pay 20% after the deductible. Same thing with preventative. There's no charge. It's free once a year. On this plan, your primary care physician is $20. Your specialist is $40. The urgent care is $40. And the emergency room is $250 plus the co-insurance. Prescription drugs are the same under both plans, a 10, 30, and a 50. So those are your two options. Now, when it comes to dental, we are making some changes to Guardian for all of our ancillary coverages. So what does that mean? For dentists, you have three types of services. You have preventative, which is your annual cleaning. Then you have your basic, and then your major. As you can see, cleanings are covered at 100%. If you have basic type services, that's done at 80%. And then if you have major, which is like a root canal, something like that, it's covered at 50%. Now, the deductible is waived for the preventative, but if you need basic or major services, you will pay the $50 deductible and then the benefits kick in. There is a calendar year maximum, meaning the benefit will pay up to $1,500 a year. Once you've hit that, benefits are exhausted. Orthodontics for dependent children only have a $1,000 lifetime benefit. Vision. So if you need those eyeglasses or eye exams for contact, your eye exam frequency is you can go once every 12 months. There's a $10 copay. For glasses, you can get glasses every 24 months for the frames, and the lenses you can get every 12 months. That's a $20 copay. And if you want the frames, we will give you an allowance up to $130. So when you go to that eyewear place to fulfill the prescription, make sure that you maximize the $130 allowance. Contacts, if you pick contacts over the frames and lenses, same thing. We'll give you an allowance up to $130, which should give you a 12-month supply of contact lenses. So life and AD&D are accidental death and dismemberment. What does this mean? This means that Double K pays for you to have $15,000 of life insurance. If for some reason you pass away due to an accident, it pays an additional $15,000. Now, there is age reductions at 35% at age 65, 60% at age 70, and 75 at age 75. Now, if you want to purchase additional life insurance, also known as voluntary life insurance, you can definitely do that. Now, why would you want to do this? Maybe the $15,000 doesn't cover everything you want, and you want some additional protection. You can do it on yourself, your spouse, or your children. Now, one trick here is, or not trick, but fact, you have to have it on yourself in order to be able to purchase spouse or children life insurance. And you can see increments of 10,000 to a maximum of $500,000 on the employee, 5,000 increments or up to 250,000 for the spouse, and 10,000 or 20,000 for children. An example of what something like this would cost if you were 35 to 39 years of age, it would be $12.30 a month for an additional 50,000 life insurance on top of the 15,000. Disability. What is disability? If for some reason you get sick or injured and you are not able to work, those bills keep coming. And what's going to help pay those bills is the disability coverage. So how does this work? It's going to pay 60% of your base annual earnings to a maximum of $1,000 a weekly benefit. So what that means is 60% not to exceed $1,000. The benefit period begins on the 14th day of the disability, and it will pay you for 11 straight weeks. So you do have to be out of work for 14 days, and then short-term disability will kick in. Long-term disability, in case you're disabled longer than that 11 weeks, same thing. It's going to pay 60% of your annual income, but it's going to be monthly, not weekly, and it'll pay up to $6,000 a month. This will take you from that 11-week short-term disability all the way to Social Security normal retirement age. So other additional coverages that you would be able to purchase. Guardian is offering a critical illness. We're not going to go through every benefit here, but if you're diagnosed with cancer, you have a heart attack, stroke, heart failure, kidney failure, you can see that the first occurrence is going to pay 100%. This is a huge benefit. You'll have forms and rate pages in your packet. Make sure you pick that up and take a strong look. As you can see, each age and each benefit amount has their own costs on a monthly basis. So make sure you ask questions. If you have any questions on that, HR will be able to assist you. An accident plan. This is for anybody that's accident prone. You want to definitely take a hard look at this. Burns, concussions, chiropractic visit, fractures, hospital admission, therapy, surgeries, x-rays. For a low price of $13.22, you can get all of your accident needs covered. Hospital indemnity. If you are having to be admitted into the hospital and you have that deductible, how could you offset the cost of that deductible? Well, for hospital, it'll pay up to $2,000 per admission. Emergency room or urgent care, it'll pay up to $150–$75. Health screenings, you just go in for your free annual health screening. They're going to pay you $50 for that. Once again, you can see the monthly rates here. If you're less than 50 years of age, it's only $48.19 a month. So the last thing, 3 things to remember. All of the free benefits that BevCap Health has to offer. If you have any questions, don't be afraid to reach out to the member advocate, where all of the benefits are online at www.bevcaphealth.com. So what are the next steps? You should be receiving enrollment form, a rate page, and a benefit handouts to go over all the benefits. Make sure you complete all forms by September 15th and get them turned in. Any questions?